Welcome to our continuing series on homeopathy with our good friend Dr. Pachegaonkar. Namaste. Many of you have written to me in appreciation of Dr. Pachegaonkar's talks, and so we are going to continue to invite him to speak on as many subjects as possible. Today, homeopathy in acute illnesses.
Yes.
Now, I am not in any way conversant with the medical terms, so please give definitions when necessary.
Acute illnesses are illnesses where the complaints arise suddenly. There are some epidemic, endemic or sporadic disorders periodically coming, as well as sometimes we get acute exacerbation of chronic disease dormant inside. So both varieties we get, where the intensity of the suffering is more, but it is like limited by time. In acute diseases, either the person recovers or sometimes it becomes fatal also, but it does not linger unless it is maintained. So this is how we look at acute illnesses.
So would an onset of flu?
It will be an acute illness.
Okay.
So the flu, like it is almost like epidemic. There is some dynamic influence in the whole environment, and in the form of virus, it goes on contaminating so many people. Someone who has good resistance doesn't develop influenza, but the person who is susceptible or doesn't have resistance against that strain develops that illness.
But I understand that strain is continually changing, modulating, if you will.
Yes. So newer and newer strains get mutated and developed. But they are a bit similar. Therefore, they are called influenza. So their basic traits will be same, though the antibodies developed against earlier strain may not be enough, so that for newer strain, new type of antibodies will have to be developed. Sometimes even the antibodies developed against the similar disorder earlier becomes a nuisance value. For example, I'll tell you in dengue fever. Suppose one strain of dengue person has contracted and developed antibodies against it. In subsequent years, if the person develops dengue infection with other strain, newer strain, the body is more relaxed under the presumption that it has antibodies, and therefore the person is not able to cope up. So gravity of the disease is more if a new strain is developed and body has antibodies against the earlier strain, and then the suffering is severe. But in general, these viral illnesses or acute illnesses, body has capability to develop antibodies and overcome the disorder. In many cases, the disease passes through subclinical phase. We have seen, especially in polio epidemic, the children, they get polio virus, they get infection, but everyone doesn't develop a post-polio paralysis. It goes in a subclinical form where sort of a loose motion, casual loose motion for 1 or 2 days, little bit of moderate degree of fever for a day, and then the child recovers by developing resistance, and then for the whole life the antibodies are there, and as if like it's a active immunization, what we call prophylactic. So for whole life the person has developed resistance for that infection. Same thing happens with influenza also.
In the US, when you go to a doctor's office, there's a big sign, "Have you had your vaccination yet?" And Sri Aurobindo is not in favor of vaccines.
Yes, actually what happens, that is what these acute illnesses, be it polio, be it influenza, be it chicken pox, be it measles, these illnesses, when the person comes down with this illness and develops antibodies against it and overcomes it, that gives wonderful, potential to develop the immunity against similar disorders. So it builds your immunity in general. And because of this crisis of developing immunity comes in the body overcomes many potential diseases when body has fought with measles, chicken pox like illnesses. So unless the disease is fatal, we should not go for vaccination, because if one person in say 1 million is going to develop this disorder and come down with illness say for 1 week or so, why should we vaccinate the whole population and develop complications? Because these vaccinations are like attenuated virus, and the fatality is even more with the vaccinations than the natural disease. Most of the times, if the disease, acute illnesses are not managed properly, then the complications occur and then there is a fatality, casualty is there, not in ordinary course. So the vaccinations, it's more what we call a disputed subject. Most of the countries, the vaccinations are made mandatory, and after some years then they say it is not necessary because the fertility is evident after that. But already they are vaccinated. Like this has happened in cholera. Earlier in India, the cholera vaccination was mandatory for pilgrimage places. You were not getting entry to such places unless you are vaccinated. They have to block the road. Either you should have a certificate that you have been vaccinated, or there you have to vaccinate. It was before 25 years. And then they realized that it gives only 30% immunity. So even without that, like if people are hygienic, they are healthy, they are sleeping well, they are hydrating themselves well, they never come down with that illness. So vaccination was more logistically as well as health wise, it was more hazardous than the disease itself.
Yeah. And much more costly to produce, to give it.
Costly, but as well as hazardous also.
Yes, yes. So what other acute diseases are we talking
mainly
about in
as a homeopath, we look at these instances as a wonderful opportunity for the person to express the disease phenomena properly, because in acute illnesses what happens, the suffering is very much fresh. So the person is able to describe everything so succinctly and clearly that we come out with remedy very easily, which is not the case with the chronic ailments. In general, we always feel that it is the acute exacerbation of the internal dyscrasia which is expressed in the form of acute illness. And therefore, if the patient comes to us in acute phase, it goes very easy for us to get the picture. I'll tell you one example. Like if someone comes with constipation, now person will not be able to give you the date from what date the person is constipated. In the course of time, he feels last 1 year I started feeling constipated. He will not be able to give you the exact genesis. But in acute illnesses, person can say that so and so date morning I got up with headache, and then the toxicity started. Then evening I developed fever. Then I developed, so series of complaints. Person will be able to give you a clear-cut chronological evolution of the disease, and for us this goes easier to work out a simillimum. Not only that, when the person has developed acute illness, see, all these signs and symptoms are indicators of reaction of the individual to the disease phenomena. Like fever, loose motion, the body ache, these are not actually the symptoms of the actually diseases, but they are the indicators of reaction of the individual to the disease. They are not the symptoms of the virus, but reaction of the individual to the virus. So based on that, we feel that time the vitality is so much roused as a phenomenon of defense, so that's the right time to give simillimum or an indicated homeopathic remedy. The person is very much susceptible because the crisis is on and the person is fully concentrated on health. So that goes easier. So in homeopathy we have wonderful remedies depending upon the genesis and evolution of the symptoms. Our task is very simple. We don't go according to diagnosis. Like if we diagnose that it is this virus what has affected, that doesn't help us in coming to the remedy. But we try to work out a simillimum, a remedy which has all these characters. So one virus, if infects some 10 people, so 10 people may describe some different type of evolution of symptoms. So based on that we will give a remedy to the person so that it is more individual, again individual who has come down with this illness and not that virus. So we treat the individual who has come down with the acute illness.
On the basis of the individual, not the group.
Correct. Yes. But there is one condition called as what we call genus epidemicus, where if it is like virus which is affecting people on mass scale, epidemic disorder, there what we do is we study 3 to 4 cases initially in details and work out a remedy, and that remedy works as a genus epidemicus for that epidemic in the population. So we gave this genus epidemicus remedy as a prophylactic also, as well as curative. And there we don't need to individualize because the virus is same, the dynamics is same, the toxin is same. So similar, it may not be same, but it will be similar.
In a certain amount of people.
Correct. So what we do is in that case, we don't need to take the complete case. Means if the initial few cases are studied, this has happened in swine flu, where some 4 or 5 years back we had swine flu. So we initially studied cases and then we saw that there is a uniform evolution of symptoms. And then we worked out like Epitorium perfoliatum as a remedy. Then the next phase like used to be sepia and third phase used to be natromore. So we gave these remedies in quick succession as a curative, and same way we gave these remedies as prophylactic and did wonderful work. Yes.
In the case of insect bites, like a flea bite, because personally I've had experience with it, going in an auto and getting bitten by fleas, auto rickshaw. And it lasts some 5-6 days. It's quite painful, itching. How do you treat that?
So see these insect bites, any poisonous, non-poisonous, because even if it is non-poisonous, it will have some local reaction. So minimal. So what we do is we have various remedies for various bites. I'll tell you one example. Like suppose a mosquito bite, commonest in India is mosquito bite. Now Anyway, mosquitoes need some blood to suck, so they would be biting freely everyone. But somehow there is a special attraction for certain individuals for mosquitoes to bite. And
I hear that all the time.
hypothetically, people have started theorizing now, if the person has malaria, he is a carrier for say malaria or filariasis, that person emits a special fragrance or a smell to the mosquitoes, and more mosquitoes are attracted, so that the progeny of the malarial virus or the filarial virus gets propagated. So they attract mosquitoes to bite and work as a carrier or a vector. So this is also known. So we have some remedies which have this character, that in Staphylococcus aureus, it's a remedy prepared from plant, Staphylococcus aureus. That remedy has one characteristic, that the individual attracts more mosquitoes for stinging. But this is observed. We had a wonderful case here worth quoting. In our ashram school, they had a picnic in our farm, and one boy caught one small Russell viper.
Oh.
And this viper he was catching, and somehow he felt that he is holding it too tightly, strangulating. So he let it little loose, and it bit his thumb. And immediately the first aid was given there. The local management, tourniquet, it was tied, and he was rushed to Jipmer. And they gave anti-venom within like 20-25 minutes. So anti-venom was working, but they found that this thumb was almost like, black and totally. They said this will be gangrene, so we have to amputate it off. And our friend Atma was there, and he suggested, we have homeopathy for this to recover circulation. They said the poison is antidoted, but already where the blood circulation has almost stopped now, it is gangrenous. So they said you can try for half an hour to 1 hour. Beyond that we can't wait. And immediately our homeopathic remedies, that Sickle-Core, then Vipera 30 and one Cedron 30. These are remedies where we give for poisonous stings. And that was started. So one remedy, Sickle-Core, enhances circulation where it is warranted. And one remedy, provides a good reaction to such stings, a healthy reaction to overcome such stings. And within hours, the circulation started, and the doctor said, now we don't need to amputate. And now also that boy, you see, not even a mark is there. He recovered in 3 months in such a way that whole thumb is intact and not even a scar of the sting. So very rarely you will find the viper person showing that here it was there. And homeopathic remedies did work. So even with the acute poisonous stings and all, many people, even in Auroville, people are keeping remedies in kit. And they manage immediately with stings, scorpion, even non-poisonous snakes. They don't go to hospital.
I see.
If it is poisonous, they give homeopathy and then add antivenom if they feel poisonous. They are all trained. Yes.
I've also heard about this black stone. Is that?
Yes, that also I have, but I don't know how it works.
I haven't seen its effect.
They keep.
Yes,
they keep
it,
the
yes,
black stone.
Yes. So, in acute diseases, what about age factoring into that?
Yes. Acute diseases actually, in children, they come down with acute illness very easily, but at the same time they recover also easily. Their susceptibility is good to both, to the disease also and to the remedy also.
Yes.
So it goes easier. But as age advances, one develops lot of resistance also. So it doesn't come down easily with the illnesses. But at the same time, as age advances, they are even late in responding also if they come down. So this happens. So dosage repetition will definitely vary depending upon the age. But one principle is always there, that if acute disease, what has come in the individual is the acute exacerbation of something in the background, a chronic disorder in the background, but because of some environmental trauma, the disease has come up, then that we consider it as the best phase to intervene, even in chronic diseases. So that is the best phase. So susceptibility is high in that phase, in that individual, and we give remedies accordingly.
Interesting.
So acute diseases, of course, we shouldn't welcome any disease, but at the same time, if the person has developed an acute exacerbation of something in the chronic background, we should be definitely, we call it as an entry point. So that really makes the case so clear and so distinct, and person being more susceptible at that time, the symptoms being more clear, we can treat the person very effectively.
Do you ever give injections in homeopathy?
See, basically, homeopathic remedies work through nerves, not through blood. We don't wait till blood circulates in the whole body if we inject. So our reaction is always through nerves. So tongue is supposed to be the richest, venue where the nerves are very much alert. So that is the best source. But if suppose person is even in coma, even with olfaction we give, even with rubbing it on a delicate skin we give, especially the skin behind the ear or near the ear, we rub homeopathic medicine, that absorption is good. In homeopathy, we don't aspire to give injections in the blood, because I don't think that is more effective. Only thing is, if we have a person with dehydration, then we don't mind injecting through intravenous the fluids as a replacement therapy. So IV fluids or the supplements we can give through injectables, but not homeopathic remedies. Not homeopathic. Of course, nowadays people are impregnating the acupuncture needles with the medicines, and those pricks they are giving. So they say it works better, like the pressure points, where the sensitive points which are diagnosed, the needle pierces that area, and that needle is medicated with homeopathic medicines. People are trying that. But other than that, we don't approve of any injectables.
How recent is this technique?
Recent means last 25-30 years people have been trying. Homeopuncture they call it, instead of calling acupuncture, but the principles are same. Otherwise, we don't have medicines of course, people have tried. We call in cancer patients especially, even we have tried injections around the cancer lesion, but somehow we don't find that we can't attribute much to these injections. One group in Europe, what they did, instead of giving remedies in a highly diluted form, they would give this remedy to a plant, and if that plant is given this homeopathic remedy, so extract of those plants they have given as injection. We call them Escador injections. When that brand became very popular, we have used this in some of the patients. But somehow our homeopathic remedies given on tongue, they are more effective than anything else. As experiments we have done it, but commonest, easiest and most effective mode is on tongue.
Even in cancer?
even in cancer, because cancer, though it is in some location, it is the whole individual which is involved in allowing the development of cancer. It can't be a local malady, even if it is a skin cancer or uterus cancer or anywhere, even in lung. It can't be a local malady. You see, everything is governed properly with good precision in the system. So unless system has some deviated function, cancer cannot exist.
Now, the case of ovarian cancer, they are not able to recognize until it's usually too late.
Yes, the reason is, I'll tell you, cancer is something where each cell is regenerating with complete precision. Say every cell is regenerating into a new cell at stipulated interval with full maturity. In cancer, what happens? The regeneration is too rapid and without developing mature cells. So this is the pathogenesis of cancer. So if the cell is growing beyond control at a rapid pace without developing maturity, the body has some mechanism to compensate it or arrest it. So at that level, the person or the physician doesn't become aware of the presence of cancer immediately. Only when the system starts failing to cope with this, and when person or the system realizes that can't cope, then they develop symptoms, and based on that the cancer is diagnosed. But retrospectively, we know that there were 101 indicators which were indicating of this crisis without being specifically being pointed out. I have seen one case, I don't want to name it. She was a very popular lady in ashram. She was coming to us for vague burning. Whole night she would just get burning, unexplained. They examined everything of hers. In top medical field, everything was examined, and they were just thinking that it is a psychological suffering. She was getting acute burning, and that too for years. And once she came down with abdominal pain after 4-5 years of suffering, and then she was diagnosed as a cancer pancreas. And then it was naturally advanced. But we realized that body was reacting
To that.
but no one could realize it is reaction to the development of cancer. One more case we know here. This lady, she had vague fever and couldn't be diagnosed. And coincidentally, her blood test showed typhoid positive, Vidal positive. So they started treating for typhoid. But when they realized after 3 weeks that it is not heeding to the antibiotics or treatment, then they thought that it is a urinary tract infection, which coincidentally she had some cells and some bacteria in urine. So they started giving intravenous antibiotics for her for urinary tract infection. After 1.5 months, they found that the ESR is raised, fever is there, but no focus of tuberculosis is found. They thought that there must be some undetected focus of tuberculosis. So she was treated for tuberculosis with anti-tubercular treatment. And after 3 months of the continuous fever and failure of all these therapies, someone detected one mass in the abdomen near the intestines. And then it was opened, but the surgeon was very clever. He said it is totally advanced, it looks malignant, but because vessels are involved and no vascular surgeon around, I won't operate it. So he closed it. Then she was taken to Chennai on a higher center, and there that she was operated and that mass was removed and her fever subsided. So what fever she was getting was in response to this developing malignancy, and that was arrested. And the moment the malignancy was removed, the tumor was removed, her fever subsided, and she was all right for more than 10 years. So, cancer is detected because we are not able to correlate it or cope with it, and then once it fails, then it is too advanced when it is detected.
And in those advanced cases, there's not a cure right now?
So that is what we say. Cure is something which is like two, different term, but at least palliation is possible.
Ah,
So in cancer cases or what we call terminal illnesses, we consider that time even the person is relieved from pain or some other complications. Even the growth is checked.
Those
That can be
palliative,
palliative.
yes.
So that is possible with homeopathic remedies.
Wonderful talk. Thank you so much, sir. Thank you.
Thank you.